These are the states that will be hit the hardest. The top 10, all red states: Mississippi, South Carolina, Tennessee, Texas, Georgia, West Virginia, Alabama, Kansas, Louisiana, and Montana. We're going from Obamacare to Trump doesn't, and people don't realize it.
Jimmy Kimmel with a preview of what's in store for millions of Americans who are facing a steep hike in the cost of health care. The Trump administration, meanwhile, is pushing forward on a plan to pull back the government's recommendation that all newborns receive vaccination against hepatitis B. A vote yesterday was delayed following a tense and chaotic meeting at the CDC rife with misinformation. The panel will meet again today. For more, we're now joined by MS Now medical analyst Dr. Vin Gupta and the president of the American Academy of Pediatrics, Dr. Susan Cressley. Our thanks to you both for being here. Dr. Gupta, just give us the sort of big picture framing here. What are they debating and why is it so important?
Jonathan, good morning. What they're debating is whether or not hepatitis B vaccine should be given immediately after birth to babies. And the reason we've moved as a country towards this policy is to prevent chronic liver infection amongst babies that if they were otherwise exposed, we know that 90% of babies exposed to hepatitis B during birth will develop chronic liver disease, which is potentially a fatal condition. And that's what we're trying to avert here, and moving towards a different paradigm, which they want to do, and they shroud it with terms like informed consent, things that already happen, or false concerns on safety of the vaccines, the very safe vaccine. It would result in tens of thousands of chronic liver disease cases, which is the concern. But I know we have Dr. Cressley here, and I wanted Dr. Cressley to come to you with a question on. We've had a lot of these conversations. I wonder what, from your vantage as the president of the American Academy of Pediatrics, are your biggest worries about all these debates, whether it's hepatitis B, aluminum, and vaccines? What's your biggest concern for parents across the country?
Yeah, before we go there, I just want to reframe the way we're thinking about this. We have safe and effective vaccines that have worked. They have been scheduled and tested. Vaccines are tested more than any other drugs because we have to do those studies on children, which requires different layers of protection for children. And so they are among the most studied drugs that we have. And here are some people who are taking what we have as fact-based science and without any science saying, we propose something different. They say they want science and transparency. Well, to try something different without a good reason and without science to back up that theirs is better is what is framing all of this and creating chaos, distrust, and lack of undermining the confidence of the American people in our vaccines. What I most worry about all of this, regardless of the votes, regardless of the conversation, the fact that they are questioning and making American families wonder if they're questioning, should I be questioning? No, they are distorting facts, misstating data, and advancing an agenda that is not in keeping with science, and our patients and families deserve better.
Dr. Cressley, just a quick follow-up. What should parents and families across the country do? Where should we go? There's state-based health alliances like the West Coast Health Alliance putting out their own information, medical societies like yours putting out their own information. Help us. Where should we go for accurate evidence-based information?
Yeah, first of all, go to the same place that you would go if your child was sick in the middle of the night. You would not call an influencer or a public policy person. You would call the physician or medical team that you trust to take care of your child when they're ill. So start there, and then come to the American Academy of Pediatrics, where we have our experts working tirelessly to make sure that they have the best information. HealthyChildren.org has all the information families needs, as well as links to trusted fact-based resources that they can trust to make confident decisions in protecting their children.
Dr. Cressley, before we go, at the rate things are going now, and we hear you, what does the future of children's health in America look like?
Well, I'm a pediatrician, so we're always filled with hope. Kids are always filled with hope. And what I would say is if every person and we all do our part to push back against the anti-science, unsubstantiated facts, and we work together as a community to make sure that every family is as confident in saying yes to vaccinations as pediatricians in the medical community are confident in recommending them, we will get back to the place where our children can go about playing and learning and living in their communities, prevented from having infections that we have science and advancements to protect them from.
President of the American Academy of Pediatrics, Dr. Susan Cressley, and MS Now medical analyst, Dr. Vin Gupta. Thank you both very much